In our first community conversation today, we're joined by Dr. David Weiss, an orthopedic trauma specialist with UVA Health. He's sitting down with cases.
All right, thank you so much, Steve. Thank you so much for being here today.
Thanks for having us.
Yes, happy to have you. We're talking today about orthopedic trauma injuries. What would you say are some of the most common and what usually causes these types of injuries?
Yeah, so the summertime, I mean, everybody wants to get outside and start recreating, which is great. We have this beautiful area around the Blue Ridge, so there's lots of opportunities for people to get outside, ride bikes, people get on their motorcycles, ride on the Blue Ridge Parkway, get on their ATVs. It's a great time, but unfortunately, this time of year, we start to see an increase in injuries. Sometimes it's people just doing their normal thing and they fall off their bike and break their arm or break their clavicle. Sometimes it's people, kids playing sports. A lot of kids are off for the summertime, so there's more camp activity, there's more sporting type activity. So we encourage people to be active. As orthopedic surgeons, we want people moving. That's part of what we like people doing, but that also does increase the risk of injury. And that's okay. That's what we're here for in the Orthopedic Trauma Division at University of Virginia.
Yeah, it's just something that happens sometimes.
It is.
Tell us, how are these types of injuries treated typically?
Well, you know, there's a lot of spectrum of injury. People can do anything from having a relatively minor injury like a sprain or a small fracture to a very major injury where they're in the emergency room, maybe being admitted to the hospital. Most orthopedic injuries are, you know, people just say break what we would call a single extremity. So you fall and break your wrist or you break your ankle. We evaluate them in the clinic oftentimes. Sometimes we have to see them in the emergency room, but oftentimes we can treat them without surgery. We can use casting or bracing or splinting and then some physical therapy. For the more serious injuries, we'll have to discuss surgery. But we have some new surgical techniques, some new anesthesia techniques that oftentimes get people back up and in action a little bit quicker, oftentimes out of the hospital quicker. So technology is helping us. It's
crazy, and it just keeps evolving. Tell us a little bit about the new after-hours orthopedic clinic. Who's that designed to serve?
Yeah, so what we've found is that a lot of times, you know, people are out recreating. Maybe they have an injury, maybe their child's got an injury at their sports practice. It's in the afternoon. They want to get an evaluation. Our emergency rooms, unfortunately, have been very busy. You know, you look around the region and people say, I don't want to go to the emergency room, it's a long wait, and it's an ankle injury, I need to have this evaluated. And so we're really trying to help out people who have acute injuries that have just kind of happened, and we want them to get a quick evaluation. So we have a clinic that's going to be open in the afternoon and the evening hours. There'll be some weekend hours. We're trying to make it convenient for when people need evaluation. Can avoid going to the emergency room, avoid having to wait. It'll be a speedy process. They'll get an evaluation by a very experienced musculoskeletal person, a person who's experienced in orthopedics. And if it's a bad enough injury that they needed surgery, they'll get an appointment right away with one of the surgeons. And you know, it just speeds up the whole process, makes it convenient for people to come in when it's better for their schedule and not just because it's business hours.
Yeah, that's a great addition to the community. And finally, when do you expect that clinic to open?
It's going to be soon. We had hoped to open earlier this summer, and just a series of events have made it difficult to get all our staffing in place. There's a lot of just paperwork that has to go on to open these new clinics. And so I would say probably in the fall time. We don't have an exact opening date, but there'll be advertising when it happens. There'll be ads probably on NBC 29. They'll talk about it, and people can look around town. There'll be digital ads, and you know, we'll advertise the hours. And it will all be at the new Orthopedic Center over on Ivy Road, our new orthopedic building. We're going to do all the care over there. So everything essentially happens in one place.
All right, something to look forward to. Thank you, as always, for taking the time to be here.
Yeah, it's great to be here. Thanks.
Yes, we'll have